So today we're going to be speaking about medical marijuana, how it helps, some qualifying conditions, the legal and public view, as well as the number of patients, dispensaries, and growers right here in Pennsylvania. So, is medical marijuana good for you? Throughout the speech, we're going to grow an understanding of how medical marijuana can affect you in the state of Pennsylvania. What is medical marijuana? Medical marijuana is a plant that is locally grown. It has the psychoactive drug THC and CBD. Our brains already produce some of the chemicals that medical marijuana has in it. There are 21 qualifying conditions for you to be able to obtain a medical marijuana card. How does medical marijuana help? It helps with pain, inflammation, autism behaviors, as well as PTSD. To name a few of the qualifying conditions, which would include autism, PTSD, and seizures. The way that medical marijuana helps with these particular conditions is once you have consumed it, it does ease some of the behaviors and actions of those with those conditions. Autism, it helps with the behavior. It definitely eases up some of the aggression that an autistic child or adult would have. With seizures, it does help kind of reduce the amount of seizures that one would have, or it even helps with pulling them out of a seizure that they are currently having. How do you obtain a medical marijuana card? There are two different types of medical marijuana cards. One is a personal card, the other is a caregiver card. The personal card is for anyone over the age of 18 and who can administer medical marijuana to themselves. A caregiver card is for a minor under the age of 18 or an adult who cannot administer to themselves. So they have to have somebody else purchase and administer the medical marijuana to them. For the personal card, first you must register under the Pennsylvania medical marijuana site. After you do so, you need to get a patient certification from a approved doctor. Once you have that patient certification, you can return to the medical marijuana site and purchase your card. Now for a caregiver, you have to do the same routine. You need to go on and register under the PA medical marijuana site. Now for a caregiver though, you do have to have a criminal background check done. This is where they'll take your fingerprints, make sure that you don't have any felonies, drug related, or anything that would basically prevent you from being able to administer or purchase the medical marijuana for the minor or the adult who can't administer themselves. Once you have your background check done, you then would go to a doctor to get a patient certification, and then you would return to the PA medical marijuana site to purchase your card. Now before you can actually go and buy any medical marijuana, you have to have that card in your hand, which usually takes about 4 to 6 weeks for it to arrive. The legal standpoint on medical marijuana. Medical marijuana was approved, actually officially legalized in April of 2016, and the first dispensary actually opened in February of 2018. According to the law, patients can only have a 30-day supply of medical marijuana on them. Now with that, there is a gray area of how that is understood, because it does not state whether or not that 30-day supply is of one particular product, or if you can have a 30-day supply of multiple products. So it's very hard for patients to know exactly how much they are allowed to have on their in their possession. Some of the legal forms are cartridges, tinctures, topical lotions, dry leaf, syringes, and capsules. Now I do personally have a couple of those. I have the dry leaf, I have the vape cartridges, as well as this right here is the way that you are permitted to use the dry leaf. You cannot smoke it. It has to be vaporized through one of those mechanisms. Um, for insurance and employers, insurance companies are not required to pay for medical marijuana. So any patient that wishes to use it, it is 100% out of pocket. The doctor's appointments, the cost of the product, any follow-up visits, all has to be paid out of pocket by the patient. Employers are not required to allow you to have your medical marijuana. So if they require a drug test, they do have the right to either deny or terminate your employment with them. So there is no protection as of right now for medical marijuana patients with employers. Now we're going to talk about the public viewpoint between the older generation and the younger generation. The younger generation is a lot more willing to accept medical marijuana into the world of medicine. They are more willing to accept and have an understanding of medical marijuana and what it can do. The older generation, on the other hand, they are fearful. They do have a lack of understanding. They are also afraid that it will send the wrong message to the younger generation, teaching them that it's okay to do drugs. They're also afraid that it will be used for the wrong reasons, like to get high or to turn it around and sell it. I do have a personal viewpoint on it, which is I personally do use it. I used to take over 10 medications a day to try to combat the many problems that I have. The main one that I take it for is PTSD. It has made a huge drastic difference. There have been tons of people around me that know me that have said how absolutely different I am as a person, how my thoughts are a lot clearer. I also use it for my autistic son. I have found that with his behaviors and taking the medical marijuana, he is a lot easier to manage. He's able to leave the house a lot more than what he could before. But there is also a downside that I have found. A lot of people are very uneducated on medical marijuana. I myself was one for a while. That younger children that take it cannot take large doses. I was given a capsule to give to my son, which ended up causing him to have seizures. It was too high of a dose of THC for him. So there are some positives, some negatives. It's all your own personal viewpoint on that. How many patients and dispensaries and growers are there in Pennsylvania? As of today, the number of patients is over 80,000 and growing. These are people that have been actually approved and actually have their medical marijuana card in hand. The number of dispensaries, which is the places that you can purchase your medical marijuana from, there are actually 35 that are opened. However, there were 52 that were approved. They just have not all opened as of yet. The number of growers, which are the people that provide the medical marijuana to the dispensaries, there are about 13 that are actually approved and licensed to grow and sell the medical marijuana in Pennsylvania. So is medical marijuana for you? A lot of people who have turned to medical marijuana have run out of options, have tried multiple pharmaceutical drugs, and this is kind of like their last effort. Others are just sick of taking pharmaceutical drugs and want a more natural way to combat their conditions. It does have its ups, which would allow you to get off of a ton of pharmaceutical medications and worrying about insurance companies covering it. You know that it's an out-of-pocket cost. The downside to it is it could be used for the inappropriate things like getting high and selling it or having alternate reactions, but it is your right to feel the way you do. Whether you agree or disagree with medical marijuana, that is 100% your choice, but hopefully by listening to this speech, it'll help you get a better understanding of what it's really, used for, as well as how people portray